You were brought here because you had the term SCIP mentioned to you. I'm here to explain what that acronym means, with the help of YouTube, a few index cards, and a nurse named Sally. This is Sally. She works as a nurse in a post-surgical area. Specifically, she works with cardiac thoracic patients, but that's a story for another video. One day, she was wondering how she could better her care practices for her patients. She took to the literature, leafing through journals, databases, and the like, when she came across the acronym SCIP. She found it stood for Surgical Care Improvement Project and was founded by the Joint Commission and the Centers for Medicare Services. It was, apparently, something a lot of hospitals used as a benchmark for care. She found a detailed list of these measures, and in truth, they seemed a bit overwhelming. On further inspection, though, she discovered they were focused on controlling infection, looking out for DVTs, and taking care of the heart. More specifically, she remembered two of these measures could be particularly applicable to her care practices. The first, INF-3, was focused on antibiotics being retimed appropriately after surgery. The second, INF-4, was more focused on controlling post-op blood glucose in cardiac patients. When she looked closer, the first seemed focused on controlling antibiotic resistance. Not only did you want to make sure the antibiotics were ordered, but also that the appropriate course was completed, not carried out too long or stopped too soon. The second made sense in terms of healing. Sally remembered how important normal glycemia was to making sure wounds healed appropriately and to keep infection at bay. She thought this was particularly relevant considering the amount of patients on her floor who were diagnosed with diabetes. Armed with this new knowledge, focused on preventing infection and best healing practices, Sally felt sure she could use SCIP to improve her care plans and help her patients live longer, healthier lives post-surgery.